Hi, my name is Amina. This is going to be my pharmacology presentation of all the 27 drugs. So first I'm going to start with pentamidine. It is used to treat serious lung infection in people with immune system problem, including people with AIDS. The classification is anti-infective. The generic name is Nupint. The mechanical of action is a funkadal. Interferes with the nuclear metabolism, inhaling DNA to RNA phosphorylase and protein synthesis. So the indication for treatment for pneumonia due to pneumonitis coronae. The contra- contraindication cautioned anemic leukemia. The side effects include bronchospasm, cough, and increased serum. The doses and frequency is if it's moderate 4 milligram for 24 hours 21 days, and still for CPC is 300 megabyte for 4 weeks. For Primisudan is used to conditions such as arthritis, blood disorder, and breathing problems, severe allergies, skin disease, cancer, eye problems, and immune system disorder. The class is corticosteroids. The brand generics are Bremiliperd or DB6-day. The action is the short-term effective corticosteroids are decreased vasodilating and permeability of capillaries as well as decreased leukocytes, migraine of site of inflammation. It is indicated to treat undersiren and immunologic disorder, respiratory and gastrointestinal disease. The core indication is a systemic fungal infection. The side effects include body fluids, mood change, weight gain, increased appetite, and nervousness. The dose and frequency for asthma acute is 40 to 80 milligrams per day. Propofol is indicated to use in general anesthesia for sedation. The classification is general anesthesia. The generic name is dufeprine. The action it exerts is sedation nurses effect to the GBA GABA receptor interaction, and it's indicated to use for induced and/or maintain anesthesia. The contraindication includes labor and delivery and naval absorption withdrawal cause. Caution if pregnant the third trimester in the early or seizure disorder. The side effects include blurry vision, confusion, dizziness, faint or light-headed when the person gets up suddenly from laying down or in a sleeping position. The doses and frequency for anesthesia in adults for healthy adults less than 55-year-old is 2 to 25 milligrams. For Pulmicort is a corticosteroid used to treat the corn disease, asthma, COPD, hay fever, and allergies. The class is corticosteroids. The generic name is budesonide. The action inhales and releases the allows reduce the release of chemicals, dilation of inflammation, and reduce the swelling of airways. The indication is to treat and maintain the mild and moderate of Crohn's disease. Various inhaled budesonide products are indicated for Broadside therapy in asthma and reduced exacerbation of COPD. Contraindications include bronchoasthma, acute severe sensitivity to milk protein, avoiding abrupt withdrawal status. The side effects include upper respiratory infection, allergies, rhinitis, sore throat. The doses and frequency: 2 puff inhale. The max is 1,440 mcg per day. Poloxam is synthesized from the used to break down extracurricular DNA in the lungs and major source of molecular factor in cystic fibrosis. The classification is Mucilax. The generic name is Durosonic alpha. The action is usually extracircular DNA decreasing mucus facility. The indication is used to adjunct therapy in the treatment of CF. The contraindication is hypersensitive to drugs, and the side effects include sore throat, fever, asthma, chest pain, decrease in forced vital capacity. The dose and frequency is gives 2.5 mg with a nebulizer. For racemine epinephrine, it is used for temporary relief of symptoms associated with bronchoasthma and to treat croup in children. So the classification is alpha/beta antagonist. The generic name is adrenaline. So the action is stimulates alpha and beta adrenaline receptor, reducing mucosal secretion and relaxing bronchial smooth muscles. The indication is commonly used in small children to have severe respiratory condition. The contraindication: caution liver seizure, diabetes, epilepsy. The side effects include increased heart rate, irregular/abnormal heartbeat, headache, nausea, sweating, restlessness, and airway swelling. The frequency is 1-3 inhalation for 3 hours. The max is 12 hours. Ibuprofen, ribavirin. It is a medication, antiviral drug used to treat some form of hepatitis C. It is called an anti. The classification is antiviral agent. The generic name is Virusol. The action: inhibits viral RNA polymerases inhibiting protein synthesis, and it's indicated for treatment with chronic hepatitis C virus infection in combination with other antiviral agents with the intent to cure. Achieve. The contraindication is for pregnant women, male of pregnant women, significant or unstable cardiac disease. The side effect name is anemia, dyspnea, nausea, stomach upset, headache, dizziness, and blurred vision. The doses and frequency: it's 400 to 700 milligrams. Serofent is a long-acting beta-2 adrenaline receptor against used to treat asthma and COPD. The classification is a LABA. The generic name is salmeterol. The action is selective synchronized beta 2 adrenaline receptor relaxing smooth muscle. The indicated treatment of asthma with inhaled corticosteroid, prevention of exercise-induced bronchospasm, and reducing the airflow obstruction and prevention of exacerbation of COPD. The contraindication for asthma without inhaled corticosteroid asthma, acute bronchospasm, acute COPD, acute deteriorating. The side effects include hoarseness, sore throat irritation, headache, rapid heartbeat, dry mouth. The dose and frequency for asthma is 1 puff for 12 hours. For bronchospasm exercise induced, 1 puff for one time. Start time 30 to 60 minutes. TOPD is 1 puff in there for 12 hours. For Spiriva, it's a long-acting bronchodilator used in the management of COPD. This is a LAMA. The generic name is tropium. The action, it antagonizes acetylcholine receptors producing bronchodilation. The indicated for maintenance of bronchospasm in COPD and to prevent exacerbation of COPD. Contraindication bronchospasm acute. Caution if hypersensitive to milk. The side effects include sore throat, coughing, dry mouth, difficulty urinating, UTI. The doses and frequency for COPD maintenance is 2 for 1 cup inhale. The max is 1 cup for 24 hours. Simulcore. This is used to control and prevent symptoms, wheezing, and shortness of breath caused by asthma and ongoing disease in the lung, acting better to agonism used as a bronchodilator in the management of asthma and COPD. The classification is a LAMA. The generic name is potassium formoterol. The action produces multiple cortisol mineral cortisol effect. Formoterol selective stimulate beta-2 agonist receptor relaxing airway muscles. It's indicated for treating COPD. The side effects include upper respiratory infection, dyspnea, voice change, cough. The dose and frequency for COPD maintenance is 2 puff 160 mcg to 4.5 mcg for adulation. Inhale bed up to 640 mcg / 18 mcg per day for asthma. For asthma, it's 2 puff inhale bed. For OR, is an anti-hemoglobin E antibody used in the treatment for severe asthma and chronic appendicitis. The classification is IgE antagonist. Generic name is omalizumab. The action inhibits IgE binding into the mast cell, mastopid, and Jurgen's cell, indicating moderate to severe persistent asthma in the patient 6 of age or others. The cause of a skin test, chronic hypotonia in adults, adolescents 12 years or older who remain sympathetic despite age 1. The contraindication, the bronchospasm acute status. Side effects include viral infection, upper respiratory infection. The dose and frequency, allergy, asthma, wood persistent is up to 150 to 375 mg for up to 2 to 4 weeks. The nasal is up to 75 to 600 milligram for 2 to 4 weeks. Theophylline is used to maintain symptoms of asthma, COPD, and other lung conditions caused by reversible airflow obstruction. The classification is metalaxyl metalaxin. The action is to increase CAMP agonized adeline receptor. It's indicated for treating the symptoms and reversible airflow obstruction associated with chronic asthma and other lung disease. The contraindication cautions if fibro, caution if sexy with multi-organ failure, caution if shock, caution if smoking habits changes. The side effects include nausea, nervousness, stomach and abdominal pain, sleeping and diarrhea. The dose and frequency for asthma/COPD is 300 to 600 milligram per day. For thromycin, it is used to treat cystic fibrosis associated with bacteria lowering respiratory rate, urinary tract, eye, skin, bone, and skin structure infection. The classification is antibacterial. The generic name is Tobrex. The action is a bacteria binds in with bacteria 3OS ribosome sunbase inhibiting protein synthesis. The indication is indicated for patients with cystic fibrosis with PA. The contraindication include intraocular injection. The side effects include rash, itchy, swelling, severe dizziness, trouble breathing. The dose and frequency is ocular injection. Dose is 1 to 2 in the eyes for up to 4 hours. For albuterol, it's a 2 beta-2 agonist receptor agonist used to treat asthma, bronchitis, COPD as well as prevent exercise-induced bronchospasms. The classification is a bronchodilator and a beta-2 agonist. The generic name is Frantulum. So the action is selective stimulate beta-2 agonist response, relaxing the airway muscles. It's indicated for symptomatic relief and prevention of bronchospasm due to or asthma, chronic and reversible obstruction airway. The contraindication hypersensitivity, the side effect in the tremor, nausea, and nervousness. The doses and frequency for immediate release form is 2 to 4 milligrams per day. The max is 34 milligram per day. For extension release form, the dose is 4 to 8 for 12 hours and the max is 34 mg. For labetalol, it's a beta-2 agonist receptor agonist used for treat COPD and asthma. The class is a bronchodilator and a SABA. The generic name is opacin. The action selective stimulate beta-2 agonist and receptor, relaxing the airway muscles. The indication is for management of COPD and asthma. The control indication is diabetes, ketoacidosis, and excessive fuel. The side effects include headache, dizziness, nervousness, and uncontrollable shaking. The dose and frequency NB for NEB bronchospasm is up to 0.63 to 1.5 mg. The bronchospasm acute, the mild moderate exacerbations dose is 1.25 for up to 20 minutes for 3 times. For severe exacerbation is 2.5 mg NBE for 20 minutes for 3 times. For EpiPen Jr., this medication is used for emergency by treating severe allergic reaction to mosquito skins, bite, food, drug, and other substances. This is a alpha and beta adrenergic agent. The generic brand is or the brand or slash generic name is Arivio Q. The action is acts as an alpha and beta receptors and is the strongest alpha receptor activator. It's indicated to treat wheezing, difficulty breathing, chest tightening, and cough caused by asthma and COPD. Contraindication is hypersensitivity. The side effects include dizziness, gray weakening, pallor, headache disorder. The dosage and frequency for adults, children weighing 30 kg or more is 0.3 milligram injected under the skin or the thighs or the muscle of the thighs. Children weighing 15 to 30 kilograms, 0.15 milligram injected under the skin or into the muscle of the thighs. Children weighing under 7.5 to 15 kilograms, 0.1 injection under the skin or the muscle into the thighs. For Brovana, this is a beta-2 adrenergic agonist and a bronchodilator used for long-term symptomatic treatment of reversible bronchoconstriction in the patient with COPD, and a beta-2 agonist and the LABA. The generic name is arformoterol. The action is selectively stimulates beta-2 agonist receptor and relaxes the smooth muscles. The indication is used for long-term symptoms, treatment of reversible bronchospasm in patients with COPD. The contraindication includes hypersensitive to drugs, asthma use, COPD, and bronchospasm. Side effects include cramps in the leg, back flu, and pain The doses and frequency include NEB for 15 mcg for 2 liters. For COPD maintenance, it's 15 mcg NBE for 12 hours. For Borrelia, it's inhaled corticosteroids that is used to maintain the treatment of asthma and chronic and COPD. This is the beta-2 agonist and a LABA and its corticosteroids. The generic name is corticosteroid 48. It inhibits multiple inflammatory cytokines and produce multiple corticosteroid and menocardial effect. The indication is indicated as an inhaler for treatment and management of asthma caused by bronchiolitis. The contraindication hypersensitive to drug and common severe hypertension, hypersensitive to milk protein status. The side effects include oral congestion, upper respiratory infection, cyanosis. The dose and frequency it comes with a DPI 100 mcg. For COPD, it's 1 puff. That would be 100 to mcg slash 250 mcg per blister. For asthma, it's 1 puff inhale. Of Comipent and Duoneb. This is a bronchodilator and a SABA. The generic name is ibuprofen, bromine, and albuterol inhale. Ibuprofen antagonizes atenolol receptor providing bronchodilator. Albuterol selectively stimulates beta-2 report. Indication is used for patients with COPD and a regular aerosol bronchodilator who continues to have evidence of bronchospasm. The contraindication hypersensitivity to drug and seizure disorder. The side effects include cough, headache, dyspnea, nausea, headache, hypertension, cardiac arrest. The dose and frequency is MDI 200 mcg. Covenant is 100 mcg and Duoneb is 0.5/2.5 mg per milliliters. For asthmatics, it's a corticosteroid used for treatment of asthma, allergic rhinitis, nasal congestion. The class is corticosteroid. The generic name is Monsignor. The action inhibits multiple inflammation kinases. Its indication for prophylaxis of agents in patients 4 years. The contraindication is hypersensitive to drugs such class. It's a bronchospasm, acute and abrupt withdrawal cautioning pediatric adolescent point. Side effects include allergic reaction, rash, swelling, thrush, apricot. The dose and frequency includes MV asthma and maintenance. 2 puff inhale for every 12 hours. The pour inhale 2 puff inhale for every 12 hours. For coleomycin, Polymyxin antibiotics used to treat bacterial infection caused by suspendable gram-negative bacteria. This is an antibiotic. The general name is Coleoetic. The action is an antibacterial, acts like the serving agent to adenosine and dispersing cell membrane. The contraindication, the treatment of acute chronic infection due to sensitive strain of certain gram-negative bacteria. The contraindication is hypersensitivity. The side effects include dizziness and upset stomach. The dose and frequency for infection severe bacteria is 300 milligram. For Adderall, this product is used to control and prevent symptoms caused by asthma or ongoing lung disease. The class is corticosteroid beta-2 adrenaline agonist. The generic name is glucoside profene simulator. The action inhibits multiple inflammation cytoses and produces multiple corticosteroids and mineralocytes effects. The indication prevents asthma and COPD. The contraindication hypersensitive to the drug and hypersensitive to milk proteins. The side effects include the white patches of tongue in the mouth, the sign of infection, mood changes, terrible sleeping, vision problems. The dose and frequency is a DPI 400 100 mcg / 50 mcg per blisters. For asthma, it's 1 puff inhaled for 12 hours. And for COPD, it's 1 puff for every 12 hours. Eucomosis, medication that is used as a mucolytic in patients with certain lung conditions and as an antidote for oxymotin overdose. The class is the Aglotis. The generic name is acylcysteine. The action it breaks the fuel rise bond, decreasing mucus velocity. The indication it's indicated for mycolytic therapy and the management for acylcysteine overdose. The contraindication is hypersensitive to drugs class and caution if asthma, caution if bronchospasm. The side effects include the white patches also inside the mouth or on your lips, sticky feeling around the nebulizer mask, fever, runny nose, and sore throat. The dose and frequency is 10% 100 mg per liters. The Flovent is a cardiosteroid inhale. It's a glucocorticoid used to treat asthma and inflammatory bronchitis, dermatitis, and non-allergic with rhinitis. The generic name is flucosine P10. The action inhibits multiple inflammatory sinuses. And indication is indicated as an inhaler for treatment and management of asthma bronchiolitis. The indication is hypersensitive to drugs, and the class, and hypersensitive to the milk protein. The side effects include itching, retching, especially in the tongue and face and the throat, and severe is dizziness and trouble breathing. The dose and frequency of asthma is a bronchodilator. The dose is 1 to 2 puff for 100 mcg or 250 mcg per blister. Per inhale steroid dose 1 to 2 puff. For hypertonic saline, the class is the Ozonic and the generic name is sodium chloride injection. The action disrupts the structure of the mucus gel, thereby reducing the viscosity and elasticity. And it's indicated for the indication is used for patients with CF cystic fibrosis. The contraindication, the patient with congestive heart failure and renal insufficiency due to their increased fluid and sodium level. The side effect increased fever, injection of the injected area, redness, and the dose and frequency is a small volume nebulizer, 0.9%, 0.3%, 0.7%, and 0.12% for 2 times per day. For hypertension B, this indicator is used for treat a very serious morbidity factor fungus infection. It works by stopping the growth of fungi. Antifungi, generic name is fungi zone. The action is antifungistic or depending on the concentration obtained in the body fluid. The indication is used to treat potential life-threatening fungal infection. The contraindication for the cardiac or multiple cardiac arrest. The side effect is disorder of the digestive system, hypotension, and the doses and frequency is infused 0.5 mg/kg to 1 to 1 mg by intravenous route 1 to 3 days. So that is all of the presentation.